Hello everyone, I'm Dr. Vivek Venkat, consultant uro-oncologist and robotic surgeon in Mumbai. Advanced prostate cancer refers to prostate cancer which has spread to other organs in the body. The most common site of prostate cancer spreading is in the bones. In the past, this was the most common way patients with prostate cancer presented to us. This was a late stage and most men neglected their symptoms until the cancer had already spread. Today, with the advent of PSA screening and other early interventions, we are getting more and more cases of early prostate cancer. However, advanced prostate cancer still forms over 50% of newly diagnosed patients in India today. The main treatment for advanced prostate cancer is hormone therapy. This refers to us stopping the testosterone in the patient's body. Testosterone is the male hormone and is the fuel for prostate cancer, and therefore when we block it, the cancer can get controlled for a number of months to years depending on each individual's response. This form of treatment can be provided in two ways. We have injections which provide us with a way of non-invasively reducing the testosterone in the body, and the other way is a simple surgical technique to remove both the man's testicles, and that completely stops all testosterone production. In fact, this simple procedure called bilateral orchidectomy was given a Nobel Prize to Professor Charles Higgins when he discovered that this reduced the spread and progress of prostate cancer. Along with hormone therapy, we usually start another agent, which may be a tablet in the form of abiraterone or enzalutamide, which are more advanced androgen suppressors, and this has been shown to have an increased effect on the patient's survival. Some patients may also be eligible for chemotherapy, and in some very fit patients, we may start all three treatments simultaneously, especially if there is a significant number of sites of disease outside the prostate. With all these approaches, prostate cancer, even in an advanced stage, can be controlled for an average of at least 2 to 3 years. Even advanced prostate cancer is relatively slow growing. So I always tell my patients not to get disheartened. Don't consider it as, a death sentence or something's going to happen very soon. It can be controlled for a fairly long time with a good quality of life. There are other techniques that we also use in order to improve the quality of life of these patients. Certain men will have difficulty in passing urine, and therefore they may need a small surgery which is called a channel or a channeling TURP in order to relieve their obstruction and be able to pass urine normally. Sometimes catheters or stents may also be needed in these cases in order to reduce the urinary obstruction. In men who have significant amount of pain because of bone metastasis or spread to the bone, we may need to provide radiation to that bone, which will help to clear that particular site of pain. Sometimes they may develop fractures. Therefore, we provide bone targeting agents like denosumab or zoledronic acid, which help reduce the risk of skeletal events and osteoporosis as a result of prostate cancer, as well as some of the treatments that we use in this disease. A newer therapy that has come up today is known as lutetium PSMA therapy or actinium PSMA therapy, where a radio-labeled ligand is attached to the PSMA, which is a prostate-specific antigen, and therefore this can target all the sites of disease that are present in the patient's body. This is a nuclear medicine treatment and is especially helpful in those patients with a lot of bone involvement, where the bone pain can also be reduced as an effect of this treatment. Every year, newer and newer medications and different trials are underway for the treatment of advanced prostate cancer, and therefore one should never lose hope. And there is a huge list in our armamentarium in order to treat these patients and provide them with improved survival as well as an adequate and comfortable quality of life. All men should have a few basic lifestyle and dietary adjustments as well. Anything that's healthy for their heart would be healthy for the prostate as well. So a reduction in sugar, strict control of their diabetes if any, reduction in salt diet, increase in green vegetables and fruits, and a reduction in red meat are what is commonly recommended in the diet. Adequate hydration is important. Calcium and vitamin D need to be supplemented because a lot of these treatments, especially hormone therapy, is known to weaken the bones. Hormone therapy also can cause a rise in the cholesterol levels, so one should be in close touch with your cardiologist to monitor the cholesterol, diabetes and cardiac status throughout the treatment. We generally monitor these patients regularly with the PSA, assess their symptoms in the form of pain or urinary trouble, and also do the PSMA PET scan at least once a year. Furthermore, as we discussed, they need to monitor with their cardiologist regarding their sugar or BP control, as well as we often do bone mineral density or DEXA scans to assess whether or not the bones are being weakened by the treatment that we have offered. If there is any rise in PSA or a change on the PET scan or in the patient's symptoms, we may need to change the medication and move on to the next line of therapy. Let me just give you an example of a young man of about 54 years of age who presented to me almost 3 years ago with retention of urine, meaning the urine had completely stopped, and he had also a small stone in his bladder as a result of the blockage. When we evaluated him, unfortunately he was found to have a metastatic or advanced prostate cancer at a very young age, and he had no family history of any such disease. We did a small channel TURP like we discussed. We removed the stone, we put him on hormone treatment as well as abiraterone, which is one of the drugs we commonly use. Today it's been 3 or 4 years since his diagnosis. He's winning table tennis tournaments in his local area, and he's leading a good quality of life despite having such an advanced disease. So I would like to just reiterate and reinforce that even advanced prostate cancer can be controlled for a long time. Don't lose heart. Go and meet your uro-oncologist. And today we have a huge line of treatments that we can offer all such patients. If you found this video to be of use, please share it with the others and also like and subscribe to my channel. Thank you.